All right. Well, good morning, everybody. We have an exciting announcement today that will help our residents and our first responders and vulnerable populations in our city protect themselves against the COVID virus. So we're here to talk about masks today, and we've been talking about masks for a while, and there's been over time some questions about their efficacy, but I think the general sentiment is settled on really the following proposition: it's far better to be wearing a mask than not wearing a mask, as all of us here can attest. I think we've all sort of bought into it. I have mine here, which I'll say something about in a moment. And the purpose of the mask is not only to protect yourself against potentially incoming virus, but also to protect others from you. We all have to assume, and as we go about our daily lives, that we may be carrying and we might not know it. And so we know that asymptomatic spread is one of the defining features of the coronavirus, and we have to take that into consideration as we take measures to protect everyone around us, all of our loved ones, all of our fellow residents. So over the last, we know that mask wearing is important. So we've emphasized mask wearing in a number of key spots. We've adopted the Centers for Disease Control guidance that says that you should wear a mask in a public setting if social distancing isn't realistic. And so so you're seeing that all around the city right now, which is great. People have been really compliant. We wanted to take it another step further in requiring it under certain circumstances. Namely, we are requiring mask wearing per order of the health department and myself among people who are. That was a city truck. We are requiring mask wearing of everyone who works at an essential business that interacts with customers. So that means folks who are cashiers, baggers at grocery stores, even the pizza delivery guy. We want those people to make sure that they're wearing masks at all times. So but it isn't just about enforcement. We want everybody to be doing this on their own volition. And so toward that end, we started working a few weeks ago with one of our premier companies in the city, Joseph Abboud Manufacturing, the makers of the best men's suits made in America. And Joe Bahena, the CEO of Joe Abboud, is here with us, who's been just enormously helpful as we've tried to figure out the mask situation. In the best tradition of American manufacturing, Joseph Abboud has retooled itself for the proverbial war effort. Just as many factories during the Second World War retooled in order to support troops deployed overseas, companies like Joseph Abboud, as well as others like Oberon and Darnett and Precise, a number of our manufacturers are making things that we need, whether it's protective equipment, in the case of Precise, O-rings for ventilators. They're doing it across the board. They're not making a lot of money for it. It's not a money-making enterprise. They're not engaged in war profiteering right now, as it were. But what they're saying is, look, we've got to play a part here. And in the case of Joseph Abboud, a real leadership role in helping make its hometown safe. So toward that end, working with Joe at Joseph Abboud, working with our city council, Ward 1 Councilor Brad Markey is here in support today. We have ordered some 53,000 masks, surgical masks, just like this one. You've seen some different colors, but they more or less look just like this, to be distributed far and wide across the city. We're targeting our first responders. About 6,000 masks have already come in. Our first responders have them. You've seen some right here today wearing them. We're targeting vulnerable populations, our elderly especially, living in long-term care facilities and senior residential facilities. And in addition to that, seniors in our community, we've been distributing them through places like Meals on Wheels and others that work directly with the elderly. We know that the virus is hardest among our senior population. We want to make sure that we're pulling out all the stops to protect them. So we're going to have a lot of masks. And what you see right here is the latest round of shipments from Joseph Abboud. So if I give you a tail of the tape, we have right now, so of the 6,000 masks that the city has already received, we have some 3,500 that have already gone to elderly residents and other at-risk groups. We've had 2,500 go to first responders and other essential city employees. As of today, we now have another 17,000 have come in to be distributed, and then over the course of the month of May, another 30,000, adding up to 53,000. So these will again go out to vulnerable populations, seniors, homeless, and a number of others. And so this is really, to my mind, a great example of teamwork between industry and government in a time of crisis. And we don't use that term lightly. It is fair to say we are in a crisis right now and have to act with a sense of urgency. So I just want to thank you, Joe, in particular. We talked early on about what Joe Abboud could do and what you guys, and the role that you guys can play. We're so proud to have you in the city anyway. You know, you make the finest quality suits, and because stores aren't open right now, there aren't suits to be sold, but you guys have pivoted in the direction of making things that are absolutely essential to be wearing. I am wearing my Joseph Abboud suit today for the record, so everybody knows. I would not come to a press conference with Joe without one on. But this is going to be really big for us. The more that people can wear masks, the better. The fact that it says New Bedford on it, MB, we hope everybody will embrace and let everybody know where you're from, proudly so, as we have right here. So. Again, I want to thank you for all of your help. I'm going to call you up to say a few words as I back off to a safe social distance. But thank you, Joe. And we, by the way, really appreciate the stylish mask. You're really outdoing yourself.
Thank you, much appreciated. Well, as the mayor said early on, we started talking about what could Joseph Abboud do to help, and you know. Internally, we quickly started talking about mass production because it felt like there was a real need. And, as the mayor said, we aren't making suits right now, but we're making about 50,000 masks a week. And we're going to continue to produce them until there's not a need. And as the mayor said, this is not, for us, a money-making venture. We're really just charging materials and our direct labor. And we're donating our overhead and our management labor. So we're happy to help. We're proud to be supporting New Bedford during this crisis, and thank you very much. Appreciate the mayor's words. Thank you.
Thank you, Joe. Thank you, Joe. So, Brian, you want to cut open one of the boxes so everybody can take a look at it, and then I'll take questions. Show the NB. Good. Awesome. Thank you, Brian. And I should hasten to add, I really want to thank Brian Mfg, our Emergency Management Director, for shepherding this effort. It's made it really easy on us and has done such an effective job in getting equipment out to the field where it's needed. So thank you, Brian. We appreciate it. All right, I'll open it up to questions.
I have a comment. Somebody's asking where they could buy one. They'd like to have a New Bedford mask.
Absolutely. So we're going to be distributing them first to vulnerable populations, but I do think we're going to have extra out there, and they're free of charge, so you don't have to go to eBay to get one of these things.
I have a few questions. Have you received any other PPE from the state? Because I read that you have received from other companies, and do you anticipate getting other types of PPE for city workers?
Yeah, not so much for city residents specifically. I mean, the masks are the PPE that will be widely distributed. That's why we ordered 53,000. But Brian, you want to come around and talk, offer some detail about where PPE stands?
Thank you, man. So right now, the city is obviously worked with Joseph Abboud. We've also worked with Oberon, which is once again another city employee, city manufacturing firm. They've been manufacturing full face shields that EMS, fire, and police have all been issued. We have gotten resources from the state as far as PPE, you know, the N95 masks, which go to our EMS providers because they're directly involved with the medical. But we have also received some of the KN95 stuff that goes out to our fire department and police department. And also through Mayor Mitchell, we're not just relying on the state because we know that everyone's pulling on it. So the city has been very actively buying our own PPE as it becomes available. So that's the big
We've
part.
also had, you want to just say a word about the donations from a number
Oh yeah, so the donations, that's a big, at the beginning of this, we had a lot of donations from companies like Greater New Bedford Vogue Tech, Fairhaven Shipyard, Fernandez Masonry, is it? Fernandez Masonry, and a multitude of different companies that have basically donated everything. We've even had some residents come and donate a bottle of hand sanitizer. And but yes, the donations have been a great, to get us going in the beginning because PPE was very difficult to find.
Yeah, and that filled a real gap because we weren't getting much from the state early on or anywhere else, and so we had a number of companies that essentially emptied their shelves of masks and gowns and whatever they had, gloves, and provided them to us, and it was very timely.
When will you be actually distributing these? Like how soon?
Well, so about 6,000 have already been distributed, and so Brian, you just want to say a word about the next round of distribution?
So these fabric masks, once we receive them, we clean them and make sure everything, and then we're going to start distributing these as probably as early as Thursday. We're going to be working with Damone Chaplin, our Director of Health, to hit our vulnerable populations first. But right now we've already pushed out a lot of these to the nursing homes. We're going to be pushing these out to our first responders again because they've been liking them. It protects the N95 to prolong the life. So we're hoping to start distributing the first 17,000, I believe, that we'll have on hand with this starting tomorrow.
A couple to Councilor Markey right now. As much as we love the Batman look.
Since we have you here, I have another question. So all essential businesses are requiring employees wear surgical masks. Do you have any
Customer-facing employees. So maybe not the guy in the stock room, but certainly the person who's at the register.
Have any businesses violated that in the city? How has that been going?
So we have that order has a fine provision. We haven't issued any fines because we've seen almost near universal compliance. Our police department is charged with enforcing that order. They've gone into a few hundred businesses and have seen very little in the way of non-compliance, and where they have, they've said, hey, we've got to wear masks. They've given a friendly reminder, and they've seen compliance. So we're seeing very little of it, and that speaks to, frankly, one of the primary reasons why New Bedford has a lower case count per capita than much of many of the cities and metro areas in the Northeast, and that's because our residents have been really great. I can't thank them enough. They've been really on top of it. They've been really understanding when it comes to social media. They've acted very reasonably, and we're going to have to continue to do it. I do want to add one more point that I probably should have made up front, which is, I can't emphasize enough, what we're doing now is not a 6 weeks exercise. The mask wearing is something that we're going to be doing for a while. People need to understand we're going to be doing it for months, if not longer, because the virus is still around. It's still going to be around. People are still going to be susceptible to getting it. And so, getting in the habit of separating oneself physically from others, getting in the habit of internalizing the habit of wearing masks will be important to keep everybody safe in the long run. Just because even after we go down the downslope of the curve, we're still susceptible. We have to understand that these precautions are really necessary.
Another question. Two former nursing homes that were converted into the COVID-19 centers here. Have there been any patients there, and how's that going?
Yeah, so there are 3 surge facilities. In order of priority, there's one just up the street here on Rockdale Avenue. That's the first one. The second one, so that's open. That has about, as of this morning, 15 patients. It had 20 the day before, so a few people have been discharged from that facility already. The next, and that has 107 beds. The next one is up on Acushnet Avenue in the Sasquin neighborhood. That has 123 beds. That is slated to open next week. We may not need it, but we'll open it up just in case. And then just in case that one fills up, there's one over at UMass Dartmouth. So that one's the backup to the backup to the backup. But we've got some redundancy now, so we're in good shape. But the one on Rockdale Avenue is up and running. It has patients. It's at roughly 14% capacity right now.
In terms of COVID-19, is there any additional measures that you're taking that we haven't talked about yet?
Lots. But so, in general, I'll say this. There's some enthusiastic masks. They wanted masks. That's what that was about. Yeah, look, so just so people can understand where things are. As of this morning, we had 535 positive cases in the city, about double that number through Greater New Bedford, right? And 15 deaths. Obviously, this is, we're in the midst of something we haven't been in our lifetimes. This is different from all those other things that might have come over. SARS, avian flu, MERS, all that. So this is not the flu. I think everybody understands that now. It's much more contagious and much more deadly. And so, we've had to mobilize in ways that, frankly, the country hasn't seen since the Second World War at every level of government. And so, what we've tried to do is to push out as much information as possible to the media as we can. And to do it in as granular of a way as possible, because what we're experiencing here in Greater New Bedford may not be the same as in Providence, may not be the same as in Boston or New York, right? Looking at the data here, there are 2 things that stand out, at least in comparison to other places. There are fewer cases per capita thus far, and so the hill that we're on is a shorter hill, but we are not on the downside of the hill. We appear to have plateaued. And so whereas in statewide in Massachusetts, statewide in Rhode Island, it appears that in general we're on the downslope. Here in Greater New Bedford, it's not clear to me that we're on the downslope. I think we've plateaued, so it's all the more reason why people should remain vigilant. What we're doing right now, we're doing all the things that we've had in place before: the social distancing enforcement, maintaining the continuity of city government, helping build up the capacity of the healthcare system. We talked about the 2 surge facilities and all the contact tracing that we've been doing literally for weeks and weeks now before it became a household term. And we're targeting protecting vulnerable population. We're targeting them for testing. That's the next big wave. As testing starts to become more readily available, there will be a big ramp up in testing in places where it's really needed. So that includes nursing homes. It includes workplaces that we need to take a closer look at. And that's the way we're going to get to a place where we can start to back off of some of the restrictions. We are not at that place yet. We are still a little ways away, and so we have to hang in there. Our residents are doing a really good job. They're doing a really good job, and we just have to stick with it so that we can make a safe and slow transition back to a new normal. It will be a new normal. It won't be the normal we knew 3 months ago. But we're going to work our way through this incrementally, and in the long run, we'll be safer for it. So it's a long explanation to you.
That answers my question.
Yeah. All right, guys. Thank you. You can have first dibs on the mask here if you'd like. And you just have to proudly wear the New Bedford logo with that. But we appreciate all of your coverage as we try to get information out to people so they can protect themselves. And I do want to thank Joe and Joseph Abboud for all their support. Thanks, guys.
Hopefully we'll get
Yeah.
it.
Well, I got to sign for it. The pickup signature. All right.
Thank you very much.
Right on. All right. Thanks, Joe. Thanks, everybody.
Take care.